Hello and welcome to another episode of Podcast DX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita. Ron can't be with us today.
And I'm just going to make sure, are we recording?
Yes, we're recording.
Okay, well, I'm Jean Marie.
Okay, collectively, we are the hosts of Podcast DX. On today's show, we are speaking with Pamela. Pamela is joining us today from the land of maple syrup, poutine, and mousse.
That's right, folks. Pamela is joining us from Auckland, New Zealand.
Wait, what? No, Jean. Pamela is joining us from Victoria, British Columbia, Canada.
Oh, okay. Well, yeah, they have maple trees there. Sure.
Yes, they do.
Sure.
Yes, they do. Pamela is happily married to her amazing husband, Ray, and they are proud parents of 2 grown kids, 3 wonderful grandsons. Wow, sounds like my family. Pamela worked for years whilst battling with pain from fibromyalgia and osteoarthritis while employed as an administrative specialist. And she was also a certified event planner. I love that. With her career behind her and now being on long-term disability, she is a blogger who writes about chronic pain, chronic fatigue, fibromyalgia, and invisible illness. In addition to the blogging, Pamela is an active volunteer with the Patient Volunteer Network, or PVN, in British Columbia. Outside of the PVN, she also has done volunteer work for Island Health as a patient advisor. She was on the advisory committee for opioid guidelines in Canada and volunteered this summer with the Downtown Victoria Business Association Busker Festival. Hello, Pamela.
Hi, Pamela.
Hi, ladies. Nice to meet you.
Now, please tell me, what is a Busker Festival?
A busker festival is when street performers come together and they perform all at the same time in different locations, all in one venue.
Oh, okay.
And I did look it up online, and the photos are just amazing.
Really?
Well, I'm always amazed at what people can do, physically. It's astonishing.
So much fun. And the talent is just outstanding.
That's great. That's great.
It's worth a trip, and then we can also look at houses out there. But anyway, Pamela, there seems to be a lot of confusion regarding fibromyalgia. Could you tell us what is fibromyalgia?
Absolutely. Fibromyalgia is the modern medical term for fibrositis. Fibromyalgia comes from fibra, which is fiber in Latin, myo, which is muscle in Greek, and algos, which is Greek for pain. So symptoms for fibromyalgia might include widespread musculoskeletal pain, fatigue, and sleep issues. And patients with fibromyalgia may also have memory and mood issues.
Okay. That's a lot going on.
Yeah.
And what symptoms led you to seek out medical care?
Well, fibromyalgia sometimes begins after a physical trauma or surgery, an infection, or significant psychological stress. Mm-hmm. And in other cases, symptoms can gradually accumulate over time with no single triggering event. In my case, it actually started with a car accident in 1991, and then it was further triggered after a surgery that I had in 2004 for severe gastric reflux disease. And during that surgery, I suffered nerve damage when an instrument was pressed up against a nerve throughout the entire surgery, and that caused major health problems for me for almost a full year. And because of the trauma that I suffered with that nerve injury, it caused a major flare-up of my fibromyalgia, and I never actually recovered from that trauma. So I've been in a fibromyalgia flare for almost that whole time ever since that surgery.
Oh, my gosh.
And then did I hear that you were just in another car accident?
Yes, actually, just yesterday, my husband and I were rear-ended.
So I hope that this isn't putting too much strain on you today because...
we're feeling a little stiff and sore today, but it could have been so much worse.
Right, okay. Well, Pamela, it sounds like you were in or have been in a lot of pain with this condition, and it's been going on for years. Was there a specific point at which you said, enough is enough already?
Well, I've definitely had moments where I'd like to get up. But my motto is and always has been, there is always hope. That's actually the name of the blog. I'm a Christ follower. My faith in God is really strong. And I've been blessed with a really positive outlook on life. So it takes a lot to truly bring me down.
Sure.
Had some really dark moments for sure, usually in situations where it's been one new health issue after another. But I've always managed to fight back to the bright side. So I've been really blessed in that regard.
That's wonderful.
That's excellent. That's a good mantra and a good way to look at life. Mm-hmm. Now, fibromyalgia sounds like a very complex disorder with a lot of different variables that can really cause havoc with your system. Mm-hmm. What would you say has helped you through the worst of the conditions?
Well, again, I think my faith in God, belief in myself and my ability to overcome bad odds, the knowledge that I've done this before and I've got a pretty good track record with getting through bad circumstances.
Okay.
But positivity really is the key. I don't dwell in the negatives, and I refuse to let my conditions define me.
That's excellent.
That's great.
Yeah, excellent. Pamela, are there any conditions which may coincide with fibromyalgia? Like, what do they call those, Jean?
Comorbidity.
There you go. Thank you. Yes.
Yeah. There you go.
This Alzheimer's kicks in when you don't want it.
Yeah.
A patient can have two or more chronic pain conditions at the same time. And unfortunately, fibromyalgia often gets kind of hidden. It's an invisible illness and can often be overlooked. People will see it as osteoarthritis. It can be identified sometimes as lupus or chronic fatigue syndrome, multiple sclerosis, and other conditions. They can all mimic fibro, so it's a difficult disease to diagnose.
Okay. And is there a specific treatment modality for fibromyalgia, or is there a cure out there?
Well, there's no cure for fibromyalgia, I can tell you that, but there are many treatments available that can help curb the pain and improve sleep.
Okay, well, that's good to hear.
Yes. Pamela, are you able to take any medications to help manage your symptoms?
Well, myself personally, I am currently on opioid medications for pain, plus I do use a magnesium rub on my legs, which is where I feel most of my fibro pain. I often feel like my legs are encased in concrete. And there are other drugs that are available for fibromyalgia, like Lyrica, Cymbalta, and Savella.
Okay.
And B12 is also something that can be successfully used for a lot of people. Many people with fibro are deficient in B12 vitamins.
Oh, okay.
Okay. Yeah, I've heard the medications that you've mentioned. I hear those on the commercials a lot. Mm-hmm. Mm-hmm. I have heard those. I know I might be a bit biased, but while reading about treatments for fibromyalgia, I came across things like therapies, like physical therapy, occupational therapy, and the like. But, they left out a biggie, recreational therapy. I didn't see that suggested.
Oh, boy. Pamela, you better get ready, and we'll get Ron on the phone shortly because it sounds like we're going into another episode of Recreational Therapists to the Rescue.
Come on now. Don't mind Gene. Ron and I, he's not here today. He's out, I think he's scuba diving. We went to grad school together, and our major was administration of recreational therapy. So it's just like, it's what we believe in. But speaking of which, I hope that you do know that there are some forms of recreational therapy that can help with pain relief. For example, water-based exercises may help people with fibromyalgia. Have you tried any therapy in a water environment, Pamela?
Well, water therapy, aquafit, things like that, those are absolutely recommended for people with fibromyalgia, along with walking, bike riding, things like that. Personally, I used to do aquafit, but right now, unfortunately, I have such bad arthritis in my right knee that it pops out of place when I'm doing water exercise, even if I'm wearing a brace.
Oh, wow.
And unfortunately, I'm unable to do much of anything because I'm wearing an air cast on my left foot because I have a tendon ripping away from my ankle. So I am literally falling apart right now.
Yeah, it sounds like it.
Now, you don't have Ehlers-Danlos as well, do you?
I do not have Ehlers-Danlos, but it feels like I do in a lot of respects.
Right. When you were talking about your knee popping out and your ankle popping, that was kind of what hit me hard.
Yeah.
It's
just the osteoarthritis.
Exactly.
Okay. And how has your diagnosis affected your relationships with family and friends?
Well, I've been really blessed with support from amazing family and friends, and I realize that I'm the exception and not necessarily the rule.
Okay.
A lot of people with fibromyalgia find themselves facing family members who don't believe them and have friends who drop them because they're never available to have fun anymore.
Mm-hmm.
Having fibromyalgia is exhausting, and
Yeah,
it's hard to
sounds
go
like
out
it.
for even a couple of hours without being in a lot of pain afterward. People don't seem to understand this because from the outside, we look perfectly normal. And this is the problem with invisible illnesses like fibromyalgia, chronic fatigue syndrome, MS, Ehlers-Danlos, arthritis, and more.
Mm-hmm.
And all we want is for people to believe us when we tell them how we feel.
Right.
Well, we definitely believe you, and we sympathize and empathize, and
Definitely.
we wish we could, there was more that could be done, because, I want to say, but I'm glad you have the positive outlook. I think that,
Very important.
yes. And
Yeah.
Pamela, do you have any additional tips, hints, or helpful advice for our listeners out there?
Absolutely. So first off, exercise is important when you live with fibromyalgia. So whatever you can do is good. Gentle walking, swimming, biking, etc. If you don't move, your muscles will atrophy, and that's not a situation you want with this condition.
Okay.
The second thing to remember is this is not your fault. You didn't
Sure.
ask for this condition, so try not to feel guilty about having it. Things are going to change in your life, and you're going to have to accept that you might be limited in what you can and can't do anymore.
Sure.
No one expects perfection. People in your life are going to have to step up and take on more than they did before to help out. So there's going to be some tough conversations that might have to take place. Finally, be gentle with your emotions. You may find that you're angry one day, crying the next, and feeling perky the day after that. Having any type of invisible illness is difficult, and you're going to find that your emotions are going to be all over the map depending on how you're feeling on any given day.
Mm-hmm.
Okay.
So accept that this is a new normal and you're not going crazy. It's all part of having this particular condition, and we all go through it. And as I say on my website, there is always hope.
That's wonderful.
Yep. So I hear you have a website. Is that how our listeners can learn more about you?
Absolutely. I blog online at PamelaJessen.com. That's the easiest way to find me.
Okay.
And I'm also open to email. So if anybody wants to email to talk more, I can be reached at pamjessen@gmail.com.
Okay. And we'll make sure we put links on our website for your website, and we'll link or list your email address as well.
Sure.
Absolutely.
Yes. Well, Pamela, we really enjoyed talking with you today, and I know that we're going to talk with you again next
Real
week.
soon.
Yes, concerning
Yeah.
another issue that you've been dealing with. But thank you so
That's
much.
right.
Thank you so much.
Thank you. It's been a real pleasure to be here today.
And if our listeners have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcasts. And as always, please keep in mind, this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undergoing or undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.